A teenager in Central Valley died in causes related to COVID-19, becoming the first juvenile death from the disease in California, public health officials announced Friday. Officials said the teen had underlying health conditions but declined to provide additional information about the age or county of residence, citing patient privacy concerns. Our hearts go out to the family and loved ones of this young person whose death is a tragic and powerful reminder of how serious COVID-19 can be, Dr. Sonia Angell, the state public health officer, said in news release. The teen died early this week at Valley Children's Hospital in Madera, the hospital said in a statement. The death of this patient reaffirms that children are not immune from the devastating impact of COVID-19 pandemic, the statement said. No other COVID-19 related death of a person under 18 has been confirmed by the state since the pandemic began. In March, Los Angeles County public health officials announced that a 17-year-old believed to have died of causes related to coronavirus, but later said more investigation was needed. The state now has recorded more than 500,000 cases of COVID-19 and 9,160 deaths. The Newscam says the Central Valley has emerged as a hotspot for new cases in California, accounting for all of the 5 counties with the highest number of new cases per 100,000 residents over the past 2 weeks, according to the Los Angeles Times statewide coronavirus tracker. Kern County topped the list, reporting 1,283.3 cases per 100,000 residents over the past 14 days, compared with 132 cases per 100 residents roughly a month ago. The county recorded 924 new cases Friday and 1 death, bringing its total to 19,335 cases and 140 deaths. Local officials attribute the rapid rise in part to an increase in testing. Some testing sites saw a sustained fourfold increase over the past several weeks. Michelle Corson, public relations officer for Kern County Public Health, said in an email that caused some labs to report supply shortages, which in turn delayed the turnaround time for the test results, she said. The surge in testing and the delayed results have recently resulted in a large number of lab results currently being received at public health. Still, a relatively high percentage of the tests performed in Kern County are coming back positive, an average of 27.5% each day over the past 2 weeks, compared with a statewide average of 7.2% according to the State Department of Public Health. That indicates an increase in community transmission of the virus. Kern County is followed by Colusa County with 768.7 cases per 100,000 residents, Merced with 651.1, Kings with 599.6, and Tulare also with 599.6. State guidelines say counties should aim for more than 100 new cases per 100,000 residents over a 2-week period. State officials had already identified the agricultural Central Valley region as an area of concern, saying the spread of the virus there underscores the iniquities of the pandemic in California. The virus has infected Black and Latino communities and poorer regions at much higher rates than more affluent and white ones. Black and Latino communities tend to have higher concentrations of essential workers who can't stay at home for financial reasons and are more likely to live and work in close quarters. Farm workers are particularly vulnerable because they tend to have fewer workplace precautions when it comes to ensuring their safety or the ability to speak out about their conditions, experts say. Earlier this week, Governor Gavin Newsom announced he would send strike teams to Kern, Merced, Kings, Tulare, and 4 other counties in the San Joaquin Valley, while asking the California legislature to approve $52 million to improve testing, tracing, and isolation protocols in those areas. By comparison to a high infection rate in the Central Valley, Los Angeles County reported the 379.5 cases per 100 residents over the past 2 weeks, and Orange County recorded 248.8. Los Angeles County added 2,488 cases Friday and 63 deaths, bringing its total to 188,524 cases and 4,622 deaths. Official noted that the number of fatalities marked an increase, comparing it with an average of 38 deaths a day the previous week. As we are seeing increases these past few days in the number of people dying from COVID-19, the reality of devastation cannot be ignored, Barbara Ferrer, the country health director, said in a statement. The Department of Public Health said in the news release that deaths are a lagging indicator that reflects exposure from weeks earlier. Orange County reported 418 new coronavirus cases and 14 deaths Friday, its second highest daily death toll since the pandemic began. 5 of the deaths were among people who live in skilled nursing facilities and 4 were among residents of assisted living facilities, officials said. The county previously reported a day high of 15 deaths on June 24 and again July 28. Orange County now accounts for the second highest number of coronavirus cases in the state, having recorded a total of 36,196 cases and 618 deaths.